Alright, so today's video is going to go through the hips of basically the function of the hips and all the angles it should be able to move in. And if it can't move in those angles, well, then it's something we need to work on. The hip has basically 6 movements, okay? Your hip is going to have hip flexion, okay? Knee comes up to the chest, you got hip extension, comes in right behind the body. Then from there, you will have your abduction coming out to the side and adduction. So adduction coming in, adding to the body. Then we're also gonna have internal rotation, so rotating inwards of the femur. And then we're gonna have external rotation, so rotating out. Here's a little thing for you. If you ever try to internally and externally rotate your hip in hip extension versus hip flexion, edge of that hip joint, you will have some ligaments that are working like a bit of a spiral, okay? So when we put it in hip extension and we try and then, and we bring it into flexion and then we go external rotation, internal rotation, we have a lot more range on that because when we flex it, that spiral tends to loosen just a little bit. That was just an interesting point. I just thought I'd mention it. Coming from your lumbar spine, okay, coming right through iliac crest into your lesser trochanter. Okay, we turn this guy around. You will see a little bony part coming out here. That is your lesser trochanter, that is your greater trochanter. Psoas muscle, psoas major, that comes right through, attaches to the lesser trochanter, and that is your main hip flexor. Okay, so that is responsible for bringing your knee to your chest. Then we have our sartorius, which is gonna attach pretty much where the anterior superior iliac spine is right here and right down to the top of that tibia. Now, that is also responsible for hip flexion, but its secondary is external rotation. So then we look at your adductors. Your adductors are responsible for adduction, okay? That's bringing the leg to the body, we're adding it, okay? And they will start from the pubic arch here. That's the origin, they'll insert right down inside that femur, okay? So you will have your magnus, which is attaches, or the origins from here, attaches right down near the bottom, okay? Then you're gonna have your longus, which is gonna typically that mid-range, and then you'll have your brevis, which attaches slightly higher up on the inside of that humerus. So therefore, when we talk about the origin and the insertion, it pulls the 2 points together, and that means adduction. We also got our rectus femoris, okay? It's one of your 4 quad muscles, okay? It basically crosses the joint of your hip and your knee, okay? It's the only quad muscle that does that, and it's responsible for hip flexion and knee extension, okay? So we look at that, it's the anterior inferior iliac spine right there, and it goes right down, that's crossing the hip joint, right down the top of that tibia. Okay, so that will cross that, hip flexion, knee extension. Hence your seated leg extensions is probably one of the best ways to train your rectus femoris, okay? Sitting in that chair. Now, sometimes you do like a bit of a stretch through the hip, still technically in hip flexion, and we extend through the knee. Our glute max for our hip extension, okay? So that is extending through the front of the hip, leg comes behind the body. It's also gonna bring in our hamstrings, okay? Our hamstring has 3 heads. Our biceps femoris, which is gonna be the long head of the hamstring. You got your semitendinosus, semimembranosus, okay? They are your 2 other heads of the hamstrings. So then we'll move on to our glutes, our hip abductors, okay? So we have glute medius, okay, which brings that leg right at the side. It's abduction. That glute medius will also be responsible for keeping that pelvic stable during gait when it's walking, okay? So making sure that stays level. Then you have your glute minimus, okay? That is also responsible for hip abduction, but also hip internal rotation on that one. And now if we were to continue on and kind of ask, oh, but my hip rotation, my hip mobility is pretty good, but I'm also getting quite sore through my hip and it's a bit stiff or whatever, blah, blah, blah. Well, the problem with when you have desk workers, upper body, fucked. Then we go to lower body, sitting in that position the whole time. So we're constantly flexed at the front of the hip, and it doesn't really, it gets to there. Maybe when we're walking, it gets to there, but it never builds strength in here, okay? And the problem is because we're so used to having the hip flexors so short and contracted the whole time, even though they're not working, they don't get any range back out here. So when we train our hip flexors, a lot of people will just go straight to straight leg lifts, sitting on the floor or banded work here. That is why it's a good opportunity to bring in, use a bench like I have, put your foot on a kettlebell. And that way we actually get into the stretch position of that hip flexor, and now we're loading it through this. That's a peak load on that exercise. A lot of people will sit there. That means that glute is stretched the whole time. We need to contract that glute. We need to work the fucking ass off of it, quite literally. But there you go. That is today's session on the hip. We will go more in detail down in the near future. But for today, that is that for this fella.